TYMLOS is a prescription medicine approved to treat postmenopausal women and increase bone density in men with osteoporosis who are at high risk for bone fracture or who cannot use another osteoporosis treatment or other osteoporosis treatments did not work well. Please see additional important safety information throughout and at the end of this video. Normally, when you're working with good bones, sometimes all you need is a little remodeling. The same is true for our actual bones. Our bones are alive and active. They continuously undergo a natural process of renewal. It's estimated our body's framework, the skeleton, is renovated about every 10 years. Inside your bones, cells work together to keep this framework strong. Two are most important: cells that remove old, existing bone, and cells that build new bone. Normally, their efforts are balanced. The amount of new bone built is equal to the amount of old bone removed. So it's out with the old, in with the new. But if you have osteoporosis, the balance is lost and your bones can get progressively weaker. Not enough new bone is built to keep up with the bone that's removed. The framework deteriorates, impacting both the quantity and quality of your bone. Osteoporosis is a silent disease because people can't actually feel this imbalance happening. They think their bones are strong, that is, until they break. Osteoporosis can weaken your entire foundation, so a bone can break anywhere from your wrist to your spine when you least expect it. And for some who have already had a fracture, one broken bone can be a sign of more to come. For those patients, it's not so much if another break will occur, it's more like when. It's important to understand how you can reduce this risk. Together with your doctor, you can plan an intervention to stand up to osteoporosis. The threat of broken bones from osteoporosis is persistent. That's why if you have osteoporosis, it's important to talk with your doctor to figure out what treatment may be right for you now. Treatments for osteoporosis can have two types of effects. They can slow down the removal of existing bone and/or they can help build new bone. TYMLOS is a treatment that is proven to rebuild new bone. TYMLOS may cause serious side effects, including possible bone cancer, osteosarcoma, decrease in blood pressure when you change position, increased blood calcium, hypercalcemia, and increased urine calcium, hypercalciuria. The most common side effects of TYMLOS in women with postmenopausal osteoporosis include dizziness, nausea, headache, fast heartbeat, feeling tired, fatigue, upper stomach pain, and spinning feeling, vertigo. The most common side effects of TYMLOS in men with osteoporosis include redness at injection site, dizziness, joint pain, swelling at injection site, pain at injection site, bruising, abdominal bloating, diarrhea, nausea, abdominal pain, and bone pain. TYMLOS mimics the way your body naturally regulates the addition and removal of bone. It activates bone formation, adding to the bone. And the way TYMLOS works still allows some bone to be removed. TYMLOS is taken using an injection pen that you can use at home or wherever you choose. Initial injections should be taken where you can sit or lie down if necessary. TYMLOS can help decrease the chance of having a fracture of the spine and other bones in postmenopausal women with thinning or weakening bones, and to help increase bone density in men with osteoporosis who are at high risk for bone fracture. Talk with your doctor today about how you can build back bone with TYMLOS. Important safety information and indications. What is the most important information I should know about TYMLOS? TYMLOS may cause serious side effects including possible bone cancer, osteosarcoma. During animal drug testing, TYMLOS caused some rats to develop a bone cancer called osteosarcoma. It is not known if people who take TYMLOS will have a higher chance of getting osteosarcoma. Tell your healthcare provider right away if you have pain in your bones, pain in any areas of your body that does not go away, or any new or unusual lumps or swelling under your skin that is tender to touch. Do not take TYMLOS if you had an allergic reaction to Abaloparatide or any of the other ingredients in TYMLOS. The inactive ingredients in TYMLOS are phenol, sodium acetate trihydrate, acetic acid, and water for injection. Before you take TYMLOS, tell your healthcare provider about all of your medical conditions, including if you have Paget's disease of the bone or other bone disease, have or have had any of the following: cancer in your bones, radiation therapy involving your bones, too much calcium in your blood, or an increase in your parathyroid hormone, hyperparathyroidism. Will have trouble injecting yourself with a TYMLOS pen and do not have someone who can help you. Are pregnant or plan to become pregnant, because TYMLOS is not for pregnant women. Or if you are breastfeeding or plan to breastfeed, it is not known if TYMLOS passes into your breast milk. You should not take TYMLOS and breastfeed. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of TYMLOS? TYMLOS can cause serious side effects, including decrease in blood pressure when you change positions. Some people may feel dizzy, have a faster heartbeat, or feel lightheaded soon after the TYMLOS injection is given. These symptoms generally go away within a few hours. Take your injection of TYMLOS in a place where you can sit or lie down right away if you get these symptoms. If your symptoms get worse or do not go away, stop taking TYMLOS and call your healthcare provider. Increased blood calcium, hypercalcemia. TYMLOS can cause some people to have a higher blood calcium level than normal. Your healthcare provider may check your blood calcium before you start and during your treatment with TYMLOS. Tell your healthcare provider if you have nausea, vomiting, constipation, low energy, or muscle weakness. These may be signs there is too much calcium in your blood. Increase urine calcium, hypercalciuria. TYMLOS can cause some people to have higher levels of calcium in their urine than normal. Increased calcium may also cause you to develop kidney stones, urolithiasis, in your kidneys, bladder, or urinary tract. Tell your healthcare provider right away if you get any symptoms of kidney stones, which may include pain in your lower back or lower stomach area, pain when you urinate, or blood in your urine. The most common side effects of TYMLOS in women with postmenopausal osteoporosis include dizziness, nausea, headache, fast heartbeat, feeling tired, fatigue, upper stomach pain, and spinning feeling, vertigo. The most common side effects of TYMLOS in men with osteoporosis include redness at injection site, dizziness, joint pain, swelling at injection site, pain at injection site, bruising, abdominal bloating, diarrhea, nausea, abdominal pain, and bone pain. These are not all the possible side effects of TYMLOS. Call your doctor for medical advice about side effects. You may report side effects to the FDA at 1-800-FDA-1088. How should I use TYMLOS? Read the complete instructions for use provided with your medicine. If you take more TYMLOS than prescribed, you may experience symptoms such as muscle weakness, low energy, headache, nausea, dizziness, especially when getting up after sitting for a while, and a faster heartbeat. Stop taking TYMLOS and call your healthcare provider right away. You should not use TYMLOS for more than 2 years over your lifetime. What is TYMLOS? TYMLOS is a prescription medicine used to treat osteoporosis in postmenopausal women who are at high risk for bone fracture or who cannot use another osteoporosis treatment or other osteoporosis treatments did not work well. TYMLOS can decrease the chance of having a fracture of the spine and other bones in postmenopausal women with thinning and weakening bones, osteoporosis, and increase bone density in men with osteoporosis who are at high risk for bone fracture or who cannot use another osteoporosis treatment or other osteoporosis treatments did not work well. It is not known if TYMLOS is safe and effective for children and young adults 18 years and younger. TYMLOS should not be used in children and young adults whose bones are still growing. Please read the full prescribing information, including medication guide, at TYMLOSPI.com.